Meanwhile, today it was confirmed that the first UK variant has been detected in Monterey County. Action News 8 reporter Christopher Salas live in Salinas with more on this case of the variant and what the county's leading infectious disease experts saying about it. Christopher?
Well, Dan, this case of the UK variant actually was diagnosed back in late February. The state recently confirming its diagnosis here in Monterey County. The person has since recovered, and while the UK variant is known to be more transmissible, we haven't had any particular surges in cases or hospitalizations here in Monterey County since that date. Now, as you mentioned, I spoke with Dr. Alan Radner tonight, and he says variants across the country and the world are causing an increase in cases, and he says that's all the more reason to get vaccinated now. Epidemiologists say there's no question it's a race of vaccines against variants. But how to prioritize vaccines to gain the quickest protection is up for debate.
Everyone doesn't agree. I mean, many people out there, many infectious disease experts believe that statistically it would be much better to give everybody one dose of the vaccine than give half the number of people 2 doses.
Dr. Radner says the question is also brought on as demand outpaces supply. One shot of a vaccine offers about 80% protection, while the 2-shot offers about 95%.
80% of a million people is considerably better than 90 or 95% of a 500,000.
Dr. Radner said in the United Kingdom, the country successfully delayed a surge by delaying second doses.
I can tell you, Tony Fauci, for instance, isn't advocating for that. Other infectious disease experts, a number of very prominent people, feel that we should be trying to get at least one dose into everybody to prevent further surges.
What do you think?
I think we should try to get one dose into everybody as quickly as possible.
Dr. Radner said the debate is happening as surges are taking place in India, Ohio, and Michigan.
Roughly 30 to 40% of the eligible population have been vaccinated, and yet they're having a very serious surge where there's no ICU beds in many parts of Michigan. So I think there's absolutely no reason why that can't happen here.
But Dr. Radner said where there's no debate is vaccines offer the best protection against variants.
But we know that many of the strains circulating throughout the United States and throughout Monterey County are definitely more infectious, and it just gives us pause and more reason to continue to be concerned about the spread of the virus in our community. And it should, again, emphasize the need to vaccinate.
And when it comes to the Johnson & Johnson vaccine being pulled from supply as a result of 6 women experiencing blood clots, Dr. Alan Radner said while it is concerning, a cost-benefit analysis needs to be done, and he says he's hoping to see that vaccine back in the supply chain sooner rather than later. Dan, back to you.
Thank you very much, Christopher.